Dr. Ayaz Samadani. This is an update program on COVID-19 in the series that have been presented for Cambria. This is number 7 program, November 25th. COVID-19 Free Cambria is a possibility. This is a responsibility of each one of us. It's a viral infection that spread from person to person. So if we observe preventive, cautious measures, we can stop the spread of this illness. If you're feeling sick or have symptoms, don't go out in public. And when you go out, wear a mask and keep your distance recommended by CDC, and wash your hands frequently. And the evidence shows that whenever we keep our physical distance of more than 6 feet, that decreases your chance of getting infection tremendously. Why that? Because the droplet infection and aerosol infection, which carries this virus, when someone speaks, coughs, or shouts, limited how far the droplets can travel. If there is a wind blowing towards you, there is more chances of getting this droplet infection. You must wash hands frequently when you touch public places, as the virus can stay up to 6 hours on different type of surfaces. Wear a mask. It protects you and it protects the others around you. CDC update. CDC changing guidelines for quarantine may shorten quarantine from 14 days to 7 or 10. New York Times update as of today, November 25th. In the last 14 days, we have seen cases rise up to 43%, and the death rate climbs to 61% of infected people. Hospitalization has increased 48%. And the total number of cases worldwide have increased. And so in the United States, 1 million more cases than last week, and 20,000 more deaths. In Wisconsin, we've seen 50,000 more cases since last week and 700 deaths. In Columbia County, there is an increase of nearly 1,000 cases. But fortunately, the measures are working. We have same number of deaths as last week, which is, I'm presenting here a relative risk between 0 to 10 becoming infected with COVID virus by an adult participating in different activities. So the highest being going to see a COVID-19 patient without any protection. Your chances of getting infections 10 out of 10. But going to a bar or athletic event of more than 1,000 people in attendance, your chances drop by 20%, 8 out of 10. Other activities like playing football, eating indoors at a restaurant, riding a public bus, working out in a gym, reduces your chance 40%, but still you have 6 out of 10 chance of getting infected. Then air travel and working as a checkout clerk, there's 50-50 chance that you may get infected. Getting a haircut or doing grocery shopping, attending a party with less than 10 people, or waiting in a line for a flu shot, your chances are 3 out of 10 that you may get infected with COVID virus. Taking care of a COVID-19 patient with complete protection, picking up takeouts, walking in a park, there is a chance of 1 in 10 of getting infection. There is absolutely no chance of getting infection if you're working from home. Here is a lesson to learn. Back to cruising, which was allowed last week. First Caribbean cruise since lockdown. Sea Dream Yacht Club took few people. Voyage was meant to demonstrate that increased safety protocols, including regular testing aboard the ship, could allow cruises to take place during the pandemic. Didn't work. 7 passengers became PCR positive. Cruise had to be abandoned and all passengers were disembarked halfway. Now, the presenting symptoms COVID-19 are similar to cold or flu or HIV infection. There's dry cough, fever, weakness, fatigue, and headaches. There may be nausea, vomiting, diarrhea, congestion, rash, and loss of appetite and smell. There's a Canadian study. They checked 2,500 children under age of 18 for severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2. Still, the researchers noted that most common symptoms among children whose test came back negative, coughing, runny nose, and fever or chills, were the same among kids who tested positive. Update on the vaccine. Ali Lilly, monoclonal antibody for mild or moderate COVID-19 infection, is given within 10 days of onset of symptoms over the age of 12 years. It's a single intravenous injection. AstraZeneca vaccine or Oxford vaccine, named AZD1222. There are 2 doses, 1 month apart, and there are 3 billion doses by 2021 available. Second long-acting monoclonal antibody cocktail by AstraZeneca is AZD7442, gives protection for 6 to 12 months. And this is the only vaccine that is given by intramuscular injection. How coronavirus vaccine will work? Researchers and scientists have taken genes for the spike protein on the surface of coronavirus and put them into a harmless virus to make a vaccine. This is injected into the patient. Vaccine enters the cell, then start to produce coronavirus spike proteins. This prompts an immune system to produce antibodies and activate killer T cells to destroy infected cells. In the patient encounters coronavirus again, the antibodies and T cells are triggered to fight the virus. Here are COVID-19 vaccines. 2 are viral vector, genetically modified, and 2 are RNA. Oxford AstraZeneca is 2 doses, 90% effective. Storage is regular fridge temperature. Moderna, RNA type, 2 doses, 95% effective, and storage is -20 centigrades up to 6 months. Pfizer BioNTech is also RNA with 2 doses and 95% effective, but requires -70 degrees for storage and transportation. They can transport this dry ice. There are other viral vector, Gamaleya, 2 doses, 92% effective and requires regular fridge temperature for storage. Q Health PCR test is a nasal swab test. Turnaround time is 20 minutes and sensitivity and specificity is excellent, 99 to 98% respectively. NBA used this test to screening, and there will be 100,000 tests per day by March 2021. Lucia home test is the other test that's available. It costs $50. Self-test at home. Initially, this will be available in California and Florida, and results will come within 30 minutes. But make sure that negative result does not rule out COVID-19, should not be used as the sole basis for management decisions. It requires a prescription and done under Zoom video conference. Test sites available, yes, we have Cambria Fire Department. So far, over 420 tests have been done. It's a drive-through, no exposure to the patients. Other test sites are City of Portage Utility Building and Marshville Clinic Health System in Beaver Dam. Recently, the news that Dodge County and rural area have highest rate of infection, and Beaver Dam Hospital is reaching its capacity. It is extremely important for us to continue with preventive measures, social distance, to keep over 6 feet, wearing a mask, washing the hands, and not going out when under the weather or sick. Thank you for your participation. This is a recorded presentation as there is Thanksgiving tomorrow, and it is expected that after 14 days of Thanksgiving, there will be an increase in number of cases and deaths. This has been proven by research done in Canada, where Thanksgiving was 2 weeks ago, and they have seen a constant rise in the cases after getting together for Thanksgiving. Thank you.